Hello and welcome to Module 7, Patient Safety.
Let's review our objectives. At the end of this module, the aide will be able to identify common causes of home accidents and safety measures that would prevent home accidents, describe the role of the aide in fall prevention and responding to falls, describe equipment related to accidents and the role of the aide in preventing those accidents, identify signs and symptoms of caregiver burnout, and describe various forms of possible abuse and explain what to do in the case of suspected abuse of a patient. Let's begin by talking about fall prevention and response. Falls are the most common type of accident for the elderly home care patient. There are many factors that can contribute to falls. There may be environmental issues such as stairs, especially carpeted stairs, cluttered rooms, items on the floor, wet floors in the kitchen or the bathroom. The patient may have medical conditions and/or medications that make them more susceptible to falls as well. And let's not forget pets. So now we move to our first handout. Handout number 1 is the CDC Falls Fact Sheet. Supervisors, this is a great time to navigate to the CDC website and review the current falls data and resources with your student. Afterwards, please come back and we'll move forward. Welcome back. Let's begin by talking about some safety measures to try and prevent falls. The aide can assist the patient in many ways to assist with fall prevention. Be sure there is adequate lighting in rooms, halls, and bathrooms. Put night lights in bedrooms, halls, and bathrooms. Do not use wax on floors when cleaning. Ensure that electrical cords are out of the way. Put a telephone next to the patient's bed. Be sure the patient is wearing non-skid shoes or slippers and that clothing does not hang low or drag on the floor. Ensure that crutches, canes, and/or walkers have non-skid tips. Check to make sure that wheelchair brakes work properly. If the patient has company, check to make sure that they did not move any of the devices the patient needs to remain stable. So I will share a personal story with you based on the last thing that I just spoke about. My mother-in-law is blind, and she had a neighbor who visited over the weekend, and the neighbor moved her walker. And so after the neighbor left, she could not find her walker. And so she was terrified. She could not stand. She could not move to try to find her walker. She was afraid she was going to fall over it. And because she is visually impaired, we have an Alexa for her so that she is able to speak into the Alexa and have it call someone to come and help her. So she did just that, and the neighbor came back and moved the device back to her. But that's really important and something that we don't think about for those of us who are sighted. So let's talk a little bit more about other types of household accidents. We've talked about fires, but there's also other types of accidents that could happen. So during a fire, a burn could be a possibility. So fires and burns cause great damage in the home, and death can come from smoke inhalation and asphyxiation. Falls related to the fire, burn, or trauma from falling objects is also a possibility. Electrical wiring problems and faulty appliances are often to blame, especially space heaters. Patients at high risk of fire, burn-related injuries or death are the very young under the age of 4 and the very old over the age of 75. In order to avoid fire and burn accidents, it would be helpful to remind your patients of some very important safety tips. Be sure there are smoke detectors on each floor of the home. Do not overload electrical outlets and never use an appliance if the cord is fraying. Turn handles of the pots on the stove so they do not point outward, where someone could bump or knock the pot over. Practice smoking safety. Never smoke in bed and never smoke if someone in the house is using oxygen. Also, be sure cigarettes or cigars are fully extinguished and cooled in an ashtray before putting into a trash can. If someone in the house is using oxygen, please be sure that appliances are turned off before unplugging them. Take care with space heaters. If they are knocked over, they could start a fire. Measure the temperature of bath water. This is really important. A lot of times as people age, they lose that ability to feel temperature. It's especially important with paralysis, children, etc. Supervise meals, especially if the patient is eating hot food in bed or lying down. So another true story. I have a person that I know personally this past summer where someone came to visit and they were outside. The visitor came and was smoking a cigarette, throw it into something on the back porch that they thought was a trash can. However, something in that ignited, exploded, and burnt the house down. So making sure that people are managing their cigarettes properly. This is a great time for you to talk to your supervisor about the policy regarding smoking as an employee. Most agencies do not permit smoking while at a patient's home or while on their premise. So take that time and discuss that. Find out your agency policy if you are a smoker. Patient safety regarding unintentional poisoning. Aides can also try to assist with the prevention of poisoning. Be sure that all medication is labeled properly. Old or expired medication should be discarded by the patient or family properly. Patients should be clear about how to take their medications. As an aide, your role with medications is limited to only assisting with self-administration of medications. If you feel like your patient is confused about their medications, call your supervisor. Accidental overdosing can occur if a patient is forgetful or has dementia, has poor vision, or has a compromising health condition. Be sure all household cleaners are labeled and stored away from where children could reach them. Also store medication and potentially toxic materials in their original containers. Keep poisonous houseplants out of reach of children and plants. Never call medication candy. Keep emergency phone numbers by the phone and or on the refrigerator. Police, ambulance, hospital, fire department. Poison control is very important. And in my household, I also keep the number for poison control for my animals. So that may be something of consideration also. Let's take a few moments to talk about carbon monoxide. Carbon monoxide is a colorless and odorless gas that can cause illness or death. Carbon monoxide poisoning could occur if a furnace is not vented properly, a chimney is clogged, or there's a running car in a closed garage. Be sure to discuss this hazard with your supervisor if they have a furnace, chimney, or garage, or even a gas stove. Please make sure that you do know how to work a gas stove if your patient has that and you are assigned to cook meals for your patient. I do not have a gas stove, and if I travel and I stay at a VRBO or an Airbnb and it has a gas stove, it always makes me very nervous because I don't know how to properly use a gas stove. So if that is something that you're not familiar with as well, please take the time and talk with your supervisor if that is an expectation of you in a patient's home with a gas stove. Symptoms would include dizziness, headache, drowsiness, nausea, or flu-like symptoms. Aides should report this to their supervisor, and they can encourage the patients to get a carbon monoxide detector for their home. This brings us to handout number 2, Home Safety Assessment. Supervisors, review this with your employee. What do you assess when you are in the home? After you've reviewed this, please come back and we'll move forward. Thanks. Now it's time for an activity. Have students get into small groups. Have each group find as many hazards as they can. Come back together and explain why each is a hazard as a class. So hit the pause button. Take a look at the handout. How many safety hazards can you spot? Welcome back. Let's talk about patient safety in regards to equipment. Safely using equipment with a patient can aid in reducing accidents and falls. For example, if a patient uses a cane or a walker, make sure all pieces are securely intact and that they have rubber tips in place to prevent slipping. Check to make sure wheelchair brakes work properly. It is important that all patient equipment be sturdy, safe, and in proper working order. If you have a concern regarding unsafe equipment, be sure to contact your supervisor. Do you not use any equipment that you have a safety concern about until you discuss it with your supervisor. Some patients will use side rails on their beds. These protect the patient from falling out of the bed and can be used to assist in turning the patient over in the bed. If a patient takes a medication at night that causes drowsiness, the patient may use side rails as a proactive measure. Be sure rails lock properly and do not fall down. Let's take a few minutes to talk about handrails and grab bars. Handrails and grab bars can assist the patient in maneuvering throughout their home or in the bathroom. Handrails might be located in hallways, stairways, and bathrooms. Grab bars might be in or near the toilet and the tub or shower. Check to make sure these are installed properly and are stable. It's very important that these are installed in a proper way because if they are just installed in the sheetrock without being in the studs, then they can easily pull away. So making sure that they have a qualified person who's installing the grab rails is really important. So now we move to activity 2. Have each student read and answer the case scenarios, or divide the class into small groups. Review the answers out loud as a class and discuss the scenarios. Hit your pause button and come back when you're ready to proceed forward. Let's talk about patient abuse. Caregiver burnout is more than feelings of stress. It encompasses the physical, emotional, and/or spiritual exhaustion that can seem to take over a person. Caring for any patient in any age group can be a challenge. While the aide may be the only in the home helping to take care for the patient for a short time, oftentimes a specific family member is there providing care all of the other times. It is important for the aide to be aware of the signs and symptoms of caregiver burnout. So we've talked about how it's much more than just a feeling of stress. It can affect one's ability to experience personal joy or feel and care for others. It is often a gradual lessening of sensitivity or compassion over time. A few symptoms include hopelessness, anxiety, decreased pleasure in day-to-day life, an apparent chronic negative attitude. If you are a caregiver, if you have been a caregiver, I applaud you. I was a caregiver for a very long time to 3 seniors in my family. And I say by far it was the most difficult job that I've ever had. And so if you've been a caregiver, you understand the monumental toll that it takes on your overall health and well-being when you are a caregiver. And that's why your role as an aide is so important. Let's discuss patient abuse some more. It's important to look for signs that the patient's caregivers may feel burned out. Report these concerns to your supervisor. People carry burdens and stress in many ways. Symptoms of caregiver burnout can have a very gradual onset. When caring for patients, it's important to look for signs that the patient's caregivers may be feeling burned out. Examples may include complaints of feeling depressed, withdrawn or isolation from others, changes in eating patterns, changes in sleeping patterns, the feelings of helplessness, hopelessness, or guilt, the increased use of stimulants or alcohol, excessive blaming, negative thinking, feelings of impatience and irritability, poor self-care, legal problems, difficulty concentrating or being preoccupied, appearing mentally and physically tired. Caregiver burnout is especially worrisome for the disabled patient. Disabilities among all ages can be stressful and can be difficult for caregivers to adapt to. If the aide has a patient whose caregivers are experiencing or expressing some of these symptoms, it is important to report that to your RN supervisor. Caregiver burnout can affect the care that your patient is receiving, and the supervisor will have the resources to better help the other caregivers. It is important for you to know the signs of abuse and recognizing those signs of abuse so that you can report those appropriately. There are times when patients become victims of abuse at the hands of their caregivers or family members. Knowing the signs of abuse is important for the aide. It is important to add that should the aide have abuse concerns or suspect abuse, speaking to the RN supervisor is the first step. The supervisor will be able to help the aide through this process and will take the necessary steps to try to resolve this issue. Never report your concerns to the family or patients first. Should the aide be wrong, this could create a very tense and hostile environment. Likewise, should it be correct, services may be discontinued and could worsen the problem for the patient, as there is no one there to advocate for the patient anymore. Remember, we've talked about before, you are a mandatory reporter. So we've talked some about abuse. Let's talk about physical abuse, and this may be a refresher. Abuse happens most often where the patient lives. Patients are often too frail or scared to speak up or fight back. Physical abuse is extremely serious. Signs cannot be ignored. Signs of physical abuse can include bruises or discoloration anywhere on the body, thumb or fingerprints, choke marks, scratches, cuts, burns, fractures, etc., unexplained bleeding. However, this may be normal if someone's taking a blood thinner. Physical restraints, a rope or a belt, burns or marks, if the patient is tied to the bed, tied into their wheelchair, misuse of medication, either prescription or over-the-counter medications. Due to possible intimidation and fear, a patient might be too scared to speak up regarding his or her possible physical abuse. Signs to look for: caregiver's refusal to let the patient be seen or talked to alone, express feelings of helplessness, implausible stories, hesitation to talk openly. So, what is an implausible story? Let's say a bedbound patient has a bruise on their face, but the patient says to you they fell. Is that plausible? Unexplained injuries, depression, broken glasses or frames, and appearing afraid of the caregiver. Emotional abuse. Causing an ill family member emotional pain or distress is also a form of abuse and can be very damaging. Emotional abuse can include yelling or intimidating the patient, humiliating or making fun of the patient, blaming the patient for any problems. There are also nonverbal behaviors which can be emotionally damaging, ignoring the patient, not letting the patient interact with others. Emotional abuse can be confusing to a patient as they may not even realize that abuse is occurring. Warning signs include the caregiver controlling or threatening the patient in front of others, dementia types behaviors when there are no medical signs of dementia, including rocking, sucking, mumbling, or staring. So let's talk a little bit about neglect and abandonment. Now, we talked about these things as definitions before. Now we're really talking about what you're looking for. Neglect and abandonment can be issues for patients as well. Not fulfilling one's role as a caretaker can lead to problems for the patients. Signs of neglect include stained or ripped clothes, poor dental hygiene, dirty or uncut fingernails or toenails, fecal matter or urine present on the patient, malnutrition, dehydration, pressure ulcers or bed sores. A caregiver can neglect a patient, or the patient can also self-neglect. Other signs include weight loss, untreated physical problems, unsafe living conditions, leaving the patient alone or unattended either at home or in a public place. Financial exploitation. Exploiting an ill family member for financial purposes is also abuse. This can be either with the patient realizing that it has happened or unknowingly coercing them. Signs include unauthorized use of funds or property, misuse of checks or credit cards, stealing money or household items, forging the patient's signature for personal gain. There are other suspicious signs to look out for: sudden financial changes, changes in wills or power of attorney, additional names on the patient accounts or credit cards, unpaid bills or lack of medical care when the patient has enough to cover it, lack of personal care items such as soap, lotion, shampoo, washcloths, or towels when the patient can afford them, unnecessary services or subscriptions. So let's move and talk a little bit about sexual abuse. Unfortunately, sexual abuse also happens to elderly and ill patients. Signs of sexual abuse to watch out for in patients are bruising around the breast or the genital area, vaginal and or anal bleeding, sexually transmitted diseases or infections, bloody or torn undergarments. Sexual abuse may not just involve inappropriate contact with the patient. It can also include showing the patient pornographic materials, forcing the patient to watch sex acts, forcing the patient to undress. So let's talk about reporting. If an aide feels that some sort of abuse is happening in the patient's home, the first step is to talk to their supervisor. In most cases, the local Adult Protective Services, APS, or Child Protective Services, CPS, will be called. For the safety of your patient, it is important to let people who are trained in these matters deal with it appropriately. It is important for the aide to be aware of what's happening in the patient's home, which may be affecting the patient's overall well-being and care. In many states, medical personnel, social workers, nursing home workers, etc., are mandated to report any types of suspected abuse. You are a mandated reporter. If an aide feels that some sort of abuse is happening in the patient's home, the first step is to talk to the supervisor. Different states have different rules as far as who should do the reporting. And normally in your situation, a supervisor will do the reporting and you will be called to provide additional information. So we've talked about APS, CPS. If I were preparing for an exam at the end of this, there are things that I would pay attention to. I've said it multiple times that you are a mandated reporter. So what that means is that not only do you report known abuse or neglect, but suspected abuse and neglect as well. I would also understand what Adult Protective Services or APS is and CPS. remembering that these are individuals that will go out and often come from the local Department of Social Services and evaluate if there is any abuse, neglect, exploitation, etc., that is happening with the patients. So again, let the people who are trained deal with this appropriately. As an aide, you have many opportunities to assist your patient with living in a safe environment. If you ever have concerns regarding any part of your patient's safety, communicate openly with your supervisor so that you are able to deliver the safest, most effective care possible. So hit the pause button and tell someone if you suspect anything unsafe.